The Arc of Livingston, Wyoming provides a wide range of programs and services to people with developmental disabilities in Livingston and Wyoming counties. Often, starting or stopping these services requires a sea of carefully filled out paperwork. The ARC created the Service Coordination Program to provide one-on-one guidance in making sure every consumer has access to necessary services.
Service coordination began under the OPWDD umbrella back in the 1980s. And at that time, the focus for service coordination was to provide supports for individuals moving out of institutions and into their own communities. One of the big roles of a service coordinator is linking and referring individuals to other needed services, such as residential habilitation, day habilitation, community hab, hourly respite, family support services, which can include family reimbursement. And then in addition, there's other services that anyone in the community can receive, such as home health aides, personal care assistant. And then we also provide a great deal of advocacy for consumers. A lot of people may not have the ability to stand up for themselves or push for the supports and services that they need, and that's the service coordinator's role. We currently serve 550 individuals, and our service coordinators have an average caseload of around 39 individuals, although efforts have currently begun to try to lower that number a bit to around 36 so that they can give people more individualized attention.
The Service Coordination Program hires highly knowledgeable individuals to facilitate the connections between consumer and service.
When we are looking to hire a service coordinators definitely need to meet certain requirements. We want individuals who can be independent workers. A lot of the service coordination job is on the road. It's not necessarily sitting in an office where you can keep an eye on people. So we want to be able to trust service coordinators to do their job and do it well.
My role as a service coordinator is to try to support my individuals with major decisions, but preserve their dignity of risk. A good example might be when somebody's pursuing moving into their own home or moving from one town to another, stopping or starting a service, and all of those decisions have some inherent risk associated with them. Every individual wants the opportunity to make their own choices, and if I take away their right to make those decisions, then that destroys their dignity of risk.
We want people who are creative and can think outside the box. So if we encounter a situation where we have people saying the consumer can't work towards goal X, Y, and Z, I want a service coordinator who would say, why not? Why can't we help them work towards those goals? And I want a service coordinator to work with the other professionals involved to try to find a way to overcome those barriers to help them either achieve those goals or get as close to those goals as possible.
To help consumers achieve their goals, the Service Coordination Program has a refined process to match them with necessary services.
If someone is interested in service coordination services, the starting point is with our agency's intake coordinator, Kathy Sullivan.
I do intake eligibility for the agency. Anybody that comes to me, I request their IEP, individual educational plan, their last psychological evaluation, and then if they have a diagnosis of autism, cerebral palsy, Down syndrome, I would need the actual evaluation from the doctors who gave that diagnosis. And then what I do is I have the family fill out the application for services, and then I forward that to DDSO. We have our own access person there for Livingston and Wyoming County. They make a determination, and then they'll write me a letter and the family saying that the person is eligible, they're not eligible, or they want more information.
Once approved for services, a consumer is steered toward independence, but never before they're ready.
Not every consumer has a service coordinator. However, any individual that's been deemed eligible can have a Medicaid service coordinator. We're able to work with them for a period of time, help get their needs met, and then if the individual doesn't seem to really need assistance anymore, then they may come out of the service coordination program at that time.
While full independence is admirable, service coordinators are prepared to assist consumers for as long as necessary.
We have some individuals in our service coordination department who have been a service coordinator for a decade or more, and in those cases, some of them have worked with the same consumers that entire time.
Brittany was approved for service coordination in 1999, and she had a lot of service coordinators until 2002 when I picked up her case. holidays, and so we've been together ever since then.
Savannah is my world. She is like my light.
Service coordinators often work closely with others that are every bit as invested in the consumer's well-being.
A planning team are essentially the various players that work with an individual. So if they attend Hilltop, it would be a case manager. Really, it could be any of the providers that work with an individual, in addition to their advocate or family members. The level of involvement that family members have with consumers varies quite a lot. So we have some consumers with very involved family members, but then we also work with a number of individuals who have the ability to be self-advocating, and they may not have any family around or any family involvement.
Being part of an ever-changing field is nothing new to service coordinators. Every change is another possibility for further helping consumers.
There's definitely a shift in the future for service coordination. The talks are that service coordinators will evolve into what's being called care coordinators. Care coordinators are supposed to be able to provide more individualized services than what we do today. And I think we're going to be forced to think outside of the service silos that we see today and try to find ways to meet individual needs in a more creative manner and a more cost-effective manner.
For more information about the Arc of Livingston, Wyoming Service Coordination Program, contact Jen Warner, Director of Service Coordination. For intake information, contact Kathy Sullivan, Day Community and Intake Coordinator.